Diphenhydramine is a medication used to relieve symptoms of allergy, hay fever, and the common cold in children. These symptoms include rash, itching, watery eyes, itchy eyes/nose/throat, cough, runny nose, and sneezing. It can also help prevent and treat nausea, vomiting, and dizziness caused by motion sickness. Diphenhydramine can also be used to help children relax and fall asleep. This medication works by blocking certain natural substances in the body that cause allergic reactions. It can help with symptoms like watery eyes and runny nose by blocking another natural substance made by the body. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products are not recommended for use in children younger than 12 years. Always ask your doctor or pharmacist for more details about using this product safely for your child. It's also important to carefully follow all dosage directions to decrease the risk for serious side effects. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients without consulting the doctor or pharmacist. Always ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When using children's allergy medication, it's important to carefully follow the directions on the product packaging. If your doctor has prescribed this medication, be sure to take it as directed. If you have any questions about how to take the medication, don't hesitate to ask your doctor or pharmacist. You can take the tablet, capsule, or liquid form of the medication by mouth, with or without food. If you're using the liquid form, be sure to measure it using a special measuring device or spoon. Don't use a regular household spoon, as it may not give you the correct dose. If you have a single-dose form of the medication, such as a single-use whistle, you won't need to measure the dose. If you're using a rapidly dissolving tablet or strip, let it dissolve on your tongue and then swallow it, with or without water. Chewable tablets should be chewed thoroughly before being swallowed. The dosage of the medication will depend on your child's age, medical condition, and how they respond to the treatment. There are many different brands and forms of this medication available, so be sure to read the dosing instructions carefully for each product. It's important not to increase the dose or take the medication more often than directed. If you're using the medication to prevent motion sickness, take the dose 30 minutes before starting the activity, such as travel. If you're using it to help your child sleep, give them the dose about 30 minutes before bedtime. If your child continues to have difficulty sleeping for more than 2 weeks, be sure to contact your doctor. And finally, if your child's condition doesn't improve or if it gets worse, it's important to let your doctor know. Some common side effects of children's allergy medication may include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth, nose, or throat. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as changes in mood or behavior, difficulty urinating, or a fast or irregular heartbeat. If you have a very serious allergic reaction to this medication, which is rare, seek medical help right away. Symptoms of a serious allergic reaction may include a rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. In the US, you can call your doctor for medical advice about any side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before giving diphenhydramine to your child for allergies, make sure to talk to your doctor or pharmacist about any allergies they may have. It's important to let them know about any breathing problems, high eye pressure, heart issues, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. This medication may also cause drowsiness, dizziness, or blurry vision, especially in older adults. It's important to avoid alcohol or marijuana while using this medication, as they can make these side effects worse. If your child has diabetes, liver disease, phenylketonuria, or any other dietary restrictions, be sure to talk to your doctor or pharmacist about using this product safely. And if your child is pregnant or breastfeeding, be sure to discuss the risks and benefits with a healthcare professional before using this medication. It's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication include antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's always best to ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, such as allergy skin tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this medication. If a child has taken too much of this medication and shows severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. You can contact a poison control center for assistance. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, you may notice changes in their behavior or mood, such as restlessness, irritability, or hallucinations, before they become very drowsy. Remember to schedule and attend all medical appointments and any necessary lab appointments for your child while they are taking this medication. It is important to monitor their progress and any potential side effects. If you forget to give your child a dose of children's allergy, give it to them as soon as you remember. If it's almost time for their next dose, just skip the missed one and give the next dose at the usual time. Don't give them a double dose to make up for the missed one. Make sure to store children's allergy at room temperature, away from moisture and light, but not in the bathroom. And be sure to keep it out of reach of children and pets. Also, do not flush the medication down the toilet or pour it into the drain unless instructed. Instead, consult your pharmacist or local waste disposal company on how to properly discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.